Hey everybody, Dr. G here. I'm a licensed clinical psychologist and personality disorder expert, and today I'm going to be giving you my thoughts on the Apple Plus show, Shrinking. As of the time of this recording, Shrinking has only aired 2 episodes. It's a show about Jason Segel, who plays a character named Jimmy, whose wife passed away, and he's dealing with that in some very difficult ways. He also happens to be a therapist. Harrison plays Dr. Paul Rhodes, another therapist that's in practice with him, and the show explores various dynamics between them and patients and so on and so forth. But I want to talk a bit about my impressions of some of the interactions they have with patients, some of the challenges and things in the show that are clearly unethical, and my overall impressions of the show as a psychologist. First, I want to say I really like this show. It's a really fun and amusing take on my profession, and I think that some of the things that are presented in it are done in a really great way. And there's no secret to the fact that he's engaging in unethical behavior, but I want to talk about why some of the stuff that Jimmy does is really egregious and why it wouldn't work as a therapeutic intervention. As a relationship expert and someone who works with couples all the time, one thing that really stood out to me was the interaction he has with the patient that he basically says, if you don't leave your boyfriend because he's terrible, you can't be my patient anymore. Okay, so obviously he's saying it in sort of an amusing way, but she feels that she really does have to do this, that she feels like he is serious, that she needs to leave her boyfriend. And this is a tough one because you can't take away the autonomy of a patient to make their own decisions. And even Harrison Ford addresses that fairly shortly after in a later scene. There's a certain amount of power that therapists have to consider they may have when it comes to interacting with certain patients. And the idea of coercing them into doing something goes against everything that we're taught and everything that we know we should and shouldn't do. I get for the purposes of the show, he feels like, I can't get through to this person. So maybe if I force her to do this, her life will get better. Something else that stood out to me is the idea that, at least at this point in the show, it's given no indication that Jimmy really took time off to process the loss of his wife without continuing to work through it. Because clearly he's fatigued, clearly he's in crisis and is acting out. And if anybody that I knew that was a professional was in his situation, it would be highly, highly, highly recommended that they take time off to work through this stuff before they go back to work, because you can't work with patients if you yourself are in the midst of a crisis. The other obvious problem are his interactions with Sean. So he's trying to connect with this young guy who's having anger management issues and can't seem to get through to him. He's being a terrible therapist. He's not really paying attention to what he's doing. So he takes him to go do mixed martial arts to get his anger out and actually get to hit somebody. There's a lot of problems with this, obviously, and even Sean on the show says, like, you're crazy, man. Like, it makes no secret that this is not healthy and this is not what he should be doing. But really, there's a lot of reasons why this wouldn't work well. One, first of all, as someone who practices mixed martial arts and has for a very long time, probably the least realistic thing on the show is the idea of walking into a gym and then them just being like, yeah, sure, you can spar with us today without knowing who you are, having any history with you. That would never happen. That's literally like the least likely thing to happen on the whole show. But that's beside the point. Point being, research does show that engaging in angry behaviors when you're feeling angry reinforces anger. So if you're feeling angry and you go down and you hit a punching bag, it's not the worst thing in the world to do, but it does reinforce the idea that when you're feeling angry, you should act on it. Now, I get that's a healthier way than punching a person, but still, there are alternative ways that you should engage if you truly want to get better at anger management. So this actually was not a great intervention, and it also didn't end up well for him at the end of the first episode, which is that Sean ends up beating somebody up. Another major problem is the level of self-disclosure that Jimmy engages in. Now, as a therapist, we talk about ourselves sometimes. People will know that I'm married, or I might make reference to something about my life during a session, or I might use some sort of example if it seems appropriate. But the level of self-disclosure, he talks about himself as though it's his own therapy session at times, talks about feeling lonely with one patient, talks about the fact that he was high or drunk or whatever it was when he saw another patient. So the level of self-disclosure is wildly inappropriate, obviously. It's funny to see somebody being so authentic and so real, but it wouldn't be helpful, and that's the problem. The idea is that he wants to connect with people in a very real way, which he hasn't been doing with his family, and he wants to do that with his patients, and he is connecting with them, but I'm not sure that it's going to be that healthy or helpful in the long run. On the other hand, one of the things I thought was interesting is that Jimmy, when it showed him being a therapist, some of the things he was saying were pretty much accurate. He works at a cognitive behavioral center, And some of the things he was saying to his patient about magical thinking is pretty much on point. There were a couple of jokes in the show that I thought were very specific to therapists that I don't know if other people would find amusing at all, but I think most therapists or psychologists would probably catch and probably think was kind of funny. One being that Gabby always has these giant jugs of water with her. And as someone who has worked in larger practices, I've seen that where there is always a therapist who has way too much water or has these crazy water bottles or is always drinking out of a water bottle. Maybe that was just a coincidence and maybe that only applies to my experience, but I thought that was not only funny but also extremely and strangely accurate to things that I've experienced and seen. Another was when Harrison Ford's character used the term antisocial to describe someone who is not being social, and then Jimmy says something like, I have a different definition of that. And that's very much something a therapist would say to another one, because antisocial personality disorder is what we call psychopaths. It doesn't mean that someone's not social or that they are shy or that they don't like being around people. It means that they don't have a conscience and have no empathy and are a psychopath. So if you say antisocial around a psychologist, oftentimes we know what people mean. But if we're to say antisocial, typically we're talking about a personality disorder, not someone who is not social. I like that they have a character like Dr. Rhodes who does demonstrate the ethical sort of normal therapist as opposed to somebody like Jimmy who's in the middle of a crisis and who probably shouldn't be practicing. But I think the show is great so far. I think Brett Goldstein, Bill Lawrence, and Jason Segel have created a really interesting show. I'm really excited to see where it's going. I'm definitely going to keep watching. And as a psychologist, it's interesting to see people portrayed like this in TV. And I also think that it's pretty clear that the things that he's doing are inappropriate. But I wanted to explain why they are and to give you a better idea of how a psychologist reacts to some of what's happened on the show. Anyway, if you enjoy this kind of content, please like and subscribe. And I wanted to mention that I was talking about relationships earlier. And if you're in a relationship that you have challenges with, I have a quiz below that might give you some insight into the impact it may be having on you if you want to take it. Anyway, thanks so much for watching.